Healthcare in America is broken. I'm a nurse practitioner, and I just got off the phone with my insurance company. My son had shoulder surgery this morning, and this morning had shoulder surgery, okay? And he's supposed to have PT on his shoulder tomorrow at 10:15. Mind you, this is today at like 3 o'clock, okay? And they called to tell me at PT that he has met his maximum number out-of-pocket visits, 20 visits for the year, because he had surgery on his opposite shoulder last year. If you know anything about shoulder surgery, you know that you have to have PT. You have to have it. You can get frozen shoulder, like you have to have PT. I know this. Insurance companies know this. So the lady at PT was like, you need to call your insurance company. I have Aetna Maritime Health. So I call them. I'm like, I'm a provider. They're surely going to understand this. I call. The lady that answers after, you go through the whole automated thing says, no, ma'am, I'm sorry. There's a cap of 20 visits, and he's already met that. It's a hard cap. I said, you understand he had surgery today. Like, he has to have PT. He can't not have PT. You just have to do it. I'm sorry, ma'am. And I said, okay, after about 5 minutes with her, let me speak to a supervisor. So she didn't want me to speak to a supervisor, but finally put me into someone on the resolution team. So the resolution team gets on the phone and says, ma'am, there is a cap on the benefits, and, there's nothing we can do about that. And says basically that I'm supposed to call my human resources department and my employer and request more visits. I said, so you're telling me that I call my employer and I say, my son needs more PT visits, and they're going to individually give us more PT visits? No, ma'am, they would have to approve that for all of the employees in the whole system. Okay, like that's going to happen? No, that's not going to happen. That's ridiculous. And so the resolution specialist says, we're going to have to do a prior authorization for these benefits. And I said, ma'am, he has to be seen tomorrow. Like, is this going to be done by tomorrow? No, we would have to get the medical records from the physician, and the review process takes about 30 days. 30 days. I said, so let's just say I'm in a position that I couldn't afford this, because you're saying it's going to be out of pocket, this PT is. Let's say I have a patient that has shoulder surgery and needs physical therapy, and my patient cannot pay out of pocket. You're telling me that they're going to have to be self-pay? How are they going to get PT? Yes, ma'am, they're going to have to be self-pay. What the heck? At this point, I say, this is crazy. This is insane. I literally said, healthcare in America is broken. This is broken. He just had shoulder surgery today. He has to have PT. And you're telling me my insurance company that I pay anywhere from $600 to $800 a month for, plus my copays, plus my deductibles, plus medicine, everything else. You're telling me you're not going to cover an additional 20 visits when he just had shoulder surgery today? No, ma'am. It's going to have to be pre-approved, and it's going to take 30 days to do that. Well, 15, but, I don't know how long it's going to take them to get the records to us. This is insane. Insane. And I'm just livid, like to the point that I could cry. Like, this is terrible. And I'm like thinking to myself, I thought maybe I should ask. Then I said, is there a patient advocate I can talk to? Oh, ma'am, yes, we can put you through to a patient advocate, but it's going to be, I'm like, can I talk to one today? No, ma'am, they're busy and they take calls nationwide. It's going to be about 4 to 48 hours. We'll put your number on a contact list to call back. That's not going to help me for my PT tomorrow. It's not going to help me for my PT tomorrow. So guess what? We're going to be self-pay tomorrow. And my next question was going to be, will we get reimbursed for what we pay now that you're not approving, if you will approve it after the physician sends you the request? I can guarantee you that answer is a no, which is why I didn't ask it. And I was so fed up at that point that I was just done. Healthcare in America is broken. It's absolutely ridiculous. Why do I pay this insurance company $800 a month or whatever I pay for family insurance on top of everything else which I can guarantee you we have had $10,000 plus out of pocket from this insurance company, most likely, close to it for the year, in addition to everything else we pay outside of health insurance because they won't cover it, like compounded GLPs for 2 people in my family. I'm just mad. I'm so mad, and healthcare is broken, and as a healthcare system, we should be ashamed of ourselves, and you should be ashamed for hanging a patient out to dry when they have surgery on one day and they need PT the next, and you won't even give them the benefit of the doubt and cover maybe 3 visits before that patient can have their physician prior auth whatever. It is absolutely ridiculous. As a provider, I understand everything the insurance company is saying, but I think it is stupid. If I was the physician, I would think it is crazy. It's nuts.